mercy fall on me. Everyone needs forgiveness, the kindness of the Savior, the hope of nations. Savior.
This is Chariot TV.
Hi, lovely people. Welcome to another time on Action Time featured on Chariot TV. My name is Dr. Ebenezer Jari, and today you might be wondering that where am I? I'm actually reporting live from my church premise, and that's why you do not see my beloved, lovely Chelsea jersey in the back. Um, as you may know or already know, for this month we are discussing sickle cell disease and sickle cell trait in lieu to it being Sickle Cell Awareness Month. And I have my beloved Dr. Stephen Bolton with me. Today we're going to be discussing something interesting as we dive in discussion from sickle cell disease, sickle cell trait, and knowing your genotype. And today we want to know the connection between sickle cell disease and sickle cell trait and malaria. So now you see that Dr. Bolton is on the screen. Hi, Dr. Bolton, how are you?
I'm doing good. Thank you for having me again today. I'm just excited to dive more into this topic that I know we've kind of been, having going through this journey together. So it's just great to put everything into full pretty much summary. I'm excited for that.
Awesome, yeah. We really appreciate you being here, sharing your expertise with our audience, and also making sure that we are educated and make informed decisions from the series that you've kind of like shared with us. I know this week hasn't been a good week for you actually in EPL, so it's Atlanta time, right?
Oh God, no comment.
Can we have the brief moment? What happened to United?
We're in a rebuilding mode, so we got to take one for the kids. But all I can say is you got to always keep your hopes high and keep fighting.
Mm-hmm.
And long story short, we're still playing in Champions League. So
yeah, right.
That's all I'll say.
You guys play Bayern this midweek, right? So as another.
Don't worry about us. We'll be okay. God's got us. That's what I'll say.
You're right.
I'm in the good spirits today. It's sad, but I'm in good spirits today.
Good. Great to hear that. So before we move on, I'd like to just check in with our technical team, just to make sure that they have their presentation on slide deck today. For our audience, it has been kind of like a Q&A session for the past two series. Today we're going to try something different. I'm going to let Dr. Bolton present about this topic and about it being malaria, then sickle cell disease and trait, and what are the connections in between them. So I'll turn it over to Dr. Bolton, and then he's going to go over it. If you have any questions, feel free to put in the comment section. I would also highly recommend that you go ahead and share the link with friends, loved ones that are not currently online, so you can educate yourself about this disease. So turn it over to you, Dr. Bolton.
Thank you. And thank you again, everyone, for joining this important discussion today. So what I'm going to do is just really, give a quick overview, just like Dr. Jari said, about everything we've been talking about, right? So we're just diving a little bit more into sickle cell. Now, my challenge and my question to you as we go through this discussion today is I want you to think about and ask yourself this question. Do you know your genotype? Do you know your sickle cell carrier status? Do your friends know their sickle cell carrier status? Do your family members know their sickle cell carrier status? Everybody that you know, very important that people know. So for the first part of the conversation, it's all about sickle cell, right? So just a quick overview is just reminding everybody that sickle cell, it is a genetic blood disorder. And what sickle cell does is that for people that have sickle cell disease, they have two copies of the sickle cell gene, right? And so the reason why I always stress this before we dive in more is just reminding people that have sickle cell is just similar. Like I said the other time, it's just similar, or just like, inheriting something from your parents, like maybe the color of your hair, the skin color you have, your eye shape, color, everything like that. Now, this is a blood disorder. And as you can see on my screen, it really just makes people, for people with sickle cell disease, instead of their blood sample looking like, as you can see on my screen here, instead of their blood samples typically looking this round shape here, it looks this sickled shape, right? And because of this shape here, it impacts how blood flows throughout the body for these people. So that is why it is important that we at least know about sickle cell disease. Now, it does impact anybody, irrespective of race or ethnicity. But as you can tell, majority of people that live with sickle cell disease are from areas and parts of the world where malaria is thought to be common. So I'm going to dive a little bit more into that and then talk more about why there is that correlation. Keeping in mind, when you think about every 2 minutes, a child is born with sickle cell disease, right? You may not have sickle cell disease, you may not know somebody with sickle cell disease, but you can do your part by knowing your genotype. And that's really what I want everybody to kind of think about today. So, again, just like I said, as we go through this discussion today, I want to just ask you, are you a sickle cell carrier? Do you know your sickle cell genotype? And I think that is something that we all need to keep asking ourselves, right? So, what does it mean for somebody to have sickle cell trait, right? I just walked you through sickle cell disease when someone has two copies of the sickle cell gene, one from each parent. Now, when someone has sickle cell trait, they only have only one copy of the sickle cell gene. As you can see on my screen here, when someone has sickle cell disease, although this is the most common type, right? There's variants. The most common type with sickle cell disease, they typically have SS, right? You see at the bottom here what I'm scrolling over. So they have one S from their mother, one S from their father. Now, someone with sickle cell trait, which is the bulk of our conversation today, they have only one S, and then they have the other typical gene, which is the A. So they typically refer to as AS. Now, the only way you find out you have sickle cell trait is through testing. Now, most people with sickle cell trait, they have no complications. And so most people just walk around, they have no idea. But there's a reason why it's important that you do know. Keeping in mind, 300 million people worldwide have sickle cell trait. About 5.5 million kids are born with sickle cell trait every year. If you look in the United States alone, and we think about Americans, like 1 in 13 Black or African American babies are born with sickle cell trait yearly. And like I said, the most common type is what we call AS. There are other forms and variants too. So just keep that thought in mind as we keep going through this conversation today. Now, just like I shared, the reason why I always think it is important that we know this information is that keep in mind when someone has sickle cell trait, all it means is that they're a carrier of sickle cell disease, which most common type you typically hear sickle cell anemia. Sometimes you hear it being referred to as that, right? It can affect anybody. It doesn't matter your skin color, your race, your ethnicity, your age. It doesn't matter. It can affect anybody. But the fact is that it affects more people that are from places and parts of the world, like in Africa and places where malaria was thought to be very common. These numbers here kind of shows you a little bit more. Again, I'm diving in on sickle cell trait, right? So these numbers kind of give you a little bit of overview, just like the Center for Disease Control always say, right? You have, I know, like I said, it's more common in African Americans, but it does also impact other people, whether it's Hispanics, who are white, people from Pacific Islander. And then globally, I think what is very fascinating is that the prevalence of sickle cell trait, again, that's when you have only one copy of the sickle cell gene, in the African region, it's estimated that about 1 in 4 people have sickle cell trait. Now, the sad news is that most people do not know, or they were not tested and have no idea that they have sickle cell trait. So where did this come from? And this is why I think we need to spend some time diving into this, right? So truly, sickle cell trait, it did evolve. It came from our body or our environment's need to fight against malaria. If you've ever been infected with malaria like myself, we do know how challenging and sometimes how annoying that could be, right? Those mosquitoes, the most common Plasmodium, right? Falciparum, those mosquitoes, all they want is blood, right? And keep in mind, sickle cell is a blood disorder. So we're getting to somewhere. Now, they love blood. And so over time, in those regions and parts of the world where malaria was common, these mosquitoes will infect people, they get malaria, and sometimes people die from malaria because those symptoms can be so severe. So our body started saying, hey, what can I do so that whenever I get infected with this malaria parasite, I can fight back? So one of the key ways that our bodies evolved was that it developed the ability to have those red blood cells that we have in our body to sickle. When I say the red blood cells sickle, all what that means is that instead of the red blood cells holding on to what it has, like in that round shape, it's going to open up and it's going to turn like flat or that moon shaped or banana shaped. When it turns into that shape, what usually happens is that everything that is in that red blood cell pretty much opens up and it gets dissolved, right? Now, that's our body's way of saying, well, if I get affected with malaria, guess what's going to happen? As soon as my body recognizes that I have malaria, that red blood cell is going to sickle, and that malaria parasite is just going to pretty much be opened up to the environment. So the nutrients, the oxygen, and everything that that red blood cell has, that malaria parasite isn't going to survive. So this is really where this whole concept of sickle cell trait came from, right? So our bodies was able to over time develop this gene switch in the blood cell where when someone gets infected with malaria, those cells know, when you get infected with malaria, you get fever, you get a lot of stress on your body. When the body recognizes those stressful environments, all it does is it tells those red blood cells that have been infected to sickle. When they sickle, it opens up the malaria pretty much, for lack of a better term, dies, right? That's our body's way of fighting malaria. Now, keep in mind, that's what would resolve if someone had sickle cell trait. They had only one copy of the gene. So they would only sickle when they needed to sickle to prevent malaria. Now, what resulted in this is that you have people with sickle cell trait. It's helping fight malaria. Now, if you have two people with sickle cell trait, if they choose to have a child, they could pass on that sickle gene that they have as kind of their superpower, and that kid will have two of those. Now, unfortunately, if a kid has sickle cell disease, the immune system is not as strong, so they cannot even fight malaria like they were supposed to. So a lot of people will ask me, okay, if having sickle cell trait kind of served as a protective factor against malaria, then I'm guessing that people with sickle cell disease should be able to not get malaria at all, which is not true. So this image I have here kind of gives you a good depiction of what I just explained to you, right? So if you see the image on the left, what you see is that for regions and parts of the world where that hemoglobin S or sickle cell trait or any sickle gene is more common, you tend to also see that it's also the same places where malaria is common, right? So there's this really, really close association. Now, if you pull a map right now of today of this sickled hemoglobin, it's all around the world now because migration, slavery, you name it, has resulted in people have trait. It's all over it's everywhere you can go. That's why it's important that it's not only something that we think it's only black people from African region. Anybody can get it, although we have to acknowledge it does disproportionately affect people that look like us. Okay, so on the right is just a summary, just like I shared, right? So when you think about it, at the top is somebody who has AA, right? Doesn't have any sickle gene. Now, when that person gets infected with malaria, the malaria parasite gets to hang around, stays in the red blood cells and does all of its damage. No problems there. Now our bodies was able to really switch up and be AS, right, which will be sickle cell trait. So for those that were able to switch up, whenever they get infected, so you see this, right? There's malaria invasion coming into that red blood. So when it gets infected, because that person has that AS and the ability to sickle, what would happen is your red blood cells will change shape. When it changes shape, it exposes everything in there so that the immune system and everything else will come fight that malaria that the person has been infected and kill it. That was our bodies who were fighting, because I'm sure, like we all know, most during those times, most people didn't have access to medicines to treat malaria. So this is our body's way of outsmarting malaria, for lack of a better term. So this is really where I want everybody to think about, right? When you think about sickle cell, just acknowledge that it's part of our history. And I always say it's important that we know and understand it so we can just empower ourselves to make decisions about it. I want to stress again, as the question says here, do you know your genotype? That is really the focus here, right? Now we do know and understand what sickle cell disease is. Sickle cell disease is really when people with sickle cell trait have a child, and if they give that child 2 copies of the sickle gene, which is the most common SS, that child will have sickle cell disease. The most important part is I think we need to get a good foundational understanding of sickle cell trait and where it came from. And as I shared with you, sickle cell trait really evolved to help us fight against malaria. Now, over time, due to slavery, migration, you name it, it can be found all around the world. And our body had just the ability to say, hey, whenever I get infected with malaria, I'm going to give my body this superpower, this machinery, or this tool to be able to sickle those red blood cells and kill that plasmodium. Unfortunately, for lack of a better term, unfortunately, the result of that is that when people have sickle cell trait, because of this switch, they pass it on to their child. Like I said here, anybody can get sickle cell disease. It doesn't matter your background. Even here in the U.S., it's estimated that 90%, right, 90% of people with sickle cell disease or sickle cell trait are from African or people from Black descent. That's something that I think is important that we always keep that in mind, right? If you know that something is part of your history, you can do something about it. Okay. Now, this just reinforces what I just shared. There's a study that has proven and shown that here in the US, only 16% of Americans know their sickle cell status. So if you think about America, right, healthcare system is good. We have newborn screening. And keep in mind, actually, here in the US, newborn screening was not standardized until the early 2000s, right? So that presents with its own problem. I like to always remind people there's a big story. A lot of people, if you know the history of the Black Panther movement, that was one of the movements that actually kind of took it upon themselves and helped people to start getting tested, because testing wasn't across board. So if you here in the US, even here in the US, people that were born before the 2000s, most people don't know their genotype because it wasn't standardized when people were having children. Hospitals were now required to do it. Just imagine how low this number looks like in other parts of the world. There's a lot of countries in the world, including Ghana, Nigeria, you name it, where fun fact, it's not a fun fact. The key fact I want everybody to remember, Nigeria actually has the highest population of sickle cell in the world. And think about most of these countries where it's more common, there's no newborn screening. We're still dealing with that today. So this just kind of reminds people that even here in the US, with advance in technology and medicine, newborn screening didn't start until the early 2000s. A lot of people in the US still don't know their genotype. And think about how much worse that number looks like in other parts of the world where newborn screenings are not prioritized, where a lot of people walk around and they don't know their genotype. So people ask me, okay, you're talking a lot about sickle cell, you're talking a lot about know your genotype. Why is it important that people know their genotype? First, and I always want to remind people, it's just a fact, right? It's important to know your genotype because you can pass it on. When 2 parents have sickle cell trait, again, there's variants, but the most common one is what we're focusing on today. When 2 parents have sickle cell trait, every single time they decide to have a child, there's a 25% chance that that child is going to be born with sickle cell disease because they can pass it on to the child. Every time. It's not just once. It's not like, okay, hey, first child we had didn't have sickle cell, so we're good to go. Every time. Every single time they decide to have a child, that child has a 25% chance of having sickle cell disease. That same child also has a 50% chance of having sickle cell trait, just like the parents, right? With every pregnancy. And then you're probably wondering, where's the other 25%? The other 25% is those 2 parents with sickle cell trait. They have a chance of having a child born without neither. So the child could be born with AA. So it's really a probability thing, right? That's why it's important that if you say you want to get married and have children, you and your partner at least know your genotype and you can make informed decisions. I always say, and I'll say it every time, I have no right. We have no right to tell people whether they should or shouldn't have children. I think what we want to do is making sure that people don't get blindsided, that people know, if they know their genotype, they can make informed decisions. Some 2 people with sickle cell trait say, hey, we still want to have children and take our chances, Maybe they live in a place in the world where they can really have finances to support a child if they had sickle cell disease. It's important to know sickle cell disease comes with its own challenges, which I'll allude to in a few. But key reason why we should know our genotype is number one, it can impact family decision making and pregnancy, just as you can see on my image here. The second thing that I want to highlight is just reminding people, just like I said, 25% chance you can have a child born with sickle cell disease. What does that look like? You can have a child born hemoglobin SS, SC. There's all these variant types. And it can be anybody, irrespective of race or ethnicity. So just like I shared, why is it that it's important that you know your genotype? Because if you were to have a child who has sickle cell disease, these are some of the things that unfortunately that child would have to deal with. Acute complications, chronic complications. We hear a lot about pain, something called vaso-occlusive crisis. It's also referred to pain crisis. People with sickle cell deal with that a lot because if you think about how I explain the disease, right? It's a disease of the blood, and blood goes to every part of our body because we need oxygen in every part of our body. Now, if somebody has sickle cell disease and that blood is sickled and it blocks those blood vessels and cannot get the blood, the nutrients, the oxygen, everything, you name it, to those parts of the body, what happens is that you have that child having a lot of complications. So that's why it's important you know your genotype, because if you were to have a child born with sickle cell disease, these are some of the complications that that child would have to deal with. It's all around the body, and pain is the most common one. The second thing that I want to remind people is, why should I know my genotype? Everybody's like, why should I care? Apart from just pregnancy, for people with sickle cell trait under certain conditions, these are some triggers that I have on the screen here. Although these are not common, I want to emphasize that most people that have sickle cell trait, they know they have sickle cell trait, they live just fine, no complications, they do just fine. Now, it's important these conditions are rare, but they can happen, right? So the goal is we stay informed and understand that if any of these were to happen, at least we know and are aware of it. So under some rare, uncommon situations, people with sickle cell trait, due to dehydration, overexertion. Overexertion is like too much exercise, vigorous activity, where sometimes maybe they don't warm up properly. And probably the most common one that we see a lot, very well documented, is a lot of athletes that have sickle cell trait. Not a lot. Some athletes, what would see, there's documentation that some of them had complications related to sickle cell trait. So these are happening. It's not common, but I always say, personally, quite honestly, I'm just sick of us playing catch up. I think unfortunately, for most of us that know a lot of disease and conditions that disproportionately affects people of Black or um, brown community, a lot of those are not prioritized. So just knowing that these complications are rare and can happen is just us taking charge of our health, right? So just know dehydration, overexertion, low oxygen, high altitude, people with sickle cell, they can sickle. Just like I explained how malaria, right? And gets infected with malaria, stressful environment, high fever, high temperature. The body has the ability to sickle and kill those plasmodium environments here, these triggers here can lead to some of these complications. So some people with sickle cell trait, they might have blood in their urine, they might have some eye complications. Rhabdomyolysis is the most common one. It's a mouthful. All it means is muscle breakdown. Like I said, when they do a vigorous exercise activity, sometimes they end up passing out because they have this thing where because of sickle cell trait, their muscles weaken. There's a rare form of kidney cancer called renal medullary carcinoma. This is a rare kidney cancer, but over 90% of people that have this cancer have sickle cell trait, and it's so fast at progressing and unfortunately killing most of these people. So again, although these complications don't happen quite often, they can happen. And if they do happen, our goal is making sure that we are proactive about these complications. Just like I've shared, and I always say, this is my staple phrase. Why should you know your genotype? If none of these things are likely to ever happen, they're very rare. It's just like wearing a seatbelt for your car. Because under those rare conditions, right, you probably never need your seatbelt. You probably never have to wear your seatbelt because most of the time we wear our seatbelt, we're just fine. But we still put our seatbelt on because you never know if someone were to cross you that one day, maybe that seatbelt could be the reason why you're alive. So although these complications tend to not happen, they can happen. And if they were to happen, at least if you knew your genotype, you can stay informed about it. And the next thing I want to highlight is just kind of taking us back to the basics, right? So my question I'm going to keep asking is, do you know your genotype? Just like I shared, if you didn't remember anything at all from today, is understand that sickle cell trait, it really started to serve as a protective factor against malaria. Now, when you don't know your genotype and you have two parents with sickle cell trait, you can have a child born with sickle cell disease, and that comes with its own complications. And aside that, some of these complications I just explained can happen. Although they're rare, they do happen. So that is why it's important that we know our genotype. So I cannot end this conversation without talking about how can you get tested to know your genotype, right? That's the magic question. Like I shared earlier, here in the US, most people still don't know their genotype. Testing wasn't prioritized until the early 2000s. So there's still a lot of that. So as we keep evolving with the sickle cell landscape, I always say newborn screenings are important. If you live in areas where newborn screenings are available, like here in the US, make sure if you have a child, just ask them, let them tell you what's your child's genotype, so at least you're informed about it. If you're already born, you don't know your genotype, if you can, try and get tested to go know your genotype. And I'm going to save you a teaser because I have something for you related to that. And then sometimes I find a lot of people that will come to me and say, hey, I was told I have sickle cell disease, but I don't have the symptoms or complications. And then they go test, they had sickle cell trait. Sometimes some of those tests were false positive or false negative. So if you're not sure what test was used, I highly encourage you to really, really ask for a new test. The best test that could tell you everything about your blood, including your sickle cell genotype, it's called an electrophoresis. You will have to ask for it, but it's important that at least you ask for some form of test to at least start the conversation and know how to do that. I always like to end my conversation by just reminding people that this is really happening. This is not an isolated thing. We're not just talking about this because we just want to. It's really happening. You have a lot of people will say that they had no idea they had sickle cell trait up until they had a child who was born with sickle cell disease. They went to the hospital happy, hey, I have a newborn. 3 months later, this child starts showing symptoms. They go learn about it, come to find a child has sickle cell disease, and they're shocked because they're like, I didn't even know I had sickle cell trait. And that's how partners find out. So this is really happening. This is not isolated. And that's why we highly encourage that people continue to know their genotype. So I have something for you. For me, kind of being a leader in this sickle cell space, this is something that I pride myself in, making sure we can have tools and resources to help people when it comes to sickle cell. I always say our primary focus is always making sure that people with sickle cell disease continue to receive the needed funding, research, and support, because the sickle cell disease, there isn't enough research and medications available. So we continue to advocate for that. But while doing that, it's also important that we keep educating about sickle cell trait too. So for me, as a leader for partnerships and research at Sickle Cell 101, we've partnered with 23andMe, where we're actually offering free testing. So the 23andMe test can help you know about like your health, your ancestry, but also as most recently, that test can also help you know about your genotype. And that's something that we want to prioritize. So we've worked with 23andMe to provide free testing to a limited amount of people. So my goal is hopefully this test will be available around the globe, but you got to start from somewhere, right? So as we speak right now, this test is only currently available to people in the US. So if you live in the US, I just talked to you a lot about sickle cell trait and you do not know your genotype. I really want to encourage you to please visit this website I'm about to show you next, because you can actually request for a free test and we will send you a free test to know your genotype if you want to. People are saying, okay, what if I already know my genotype and I want to get the test? That's also an option. But for me, my biggest goal is making sure we prioritize people that do not know their genotype to get a test. So if you wanted to get a free 23andMe test, you live in the US, to know about your health, ancestry, anything else, you can also apply or fill the form. We're going to prioritize and really make sure that people that do not know their genotype know their genotype. So this is a big partnership. If you haven't already followed us, please Follow Sickle Cell 101 on all social media platforms. This news came out this last week with our partners with 23. It's all over there. Great press releases out there. If you visit the www.sc101.org/23andme, as you see on the screen, you're going to see this article. It's a press release that shows the announcement. And if you go to SC101, this is the most important website. If you go to sc101.org/your genotype, you can fill out a form. And if you meet the criteria, we're going to send you a free test so you can know your genotype. Again, that's the theme of the conversation for Sickle Cell Awareness Month for us. We're still talking about sickle cell disease. We also want to make sure that people that do not know their genotype know their genotype. If that's something you want to do, you don't know your genotype, you want to learn more, I think it's important that at least you know that we have this offer now through this partnership with 23. I mean, it's something that's important. So as I end my conversation today, the last thing I want to leave everybody with is always remember, right? We always, I think in our community, sickle cell is one of those things we don't like talking about because most people are not comfortable with it. I want us to get in a space where we're comfortable talking about sickle cell because it is part of our history. Sickle cell trait, like I said earlier, it did evolve in regions and parts of the world where malaria was common to serve as a protective factor. Now, over time, when you have people with sickle cell trait, you decide to have a child, just like this image shows again on this right-hand side. When two parents have sickle cell trait here, each can pass on the S gene to the child, and that child can have AS just like the parents. They can also pass only the A to the child, and the child have AA. So they have neither sickle cell disease nor sickle cell trait. They can also pass S and an S each from a parent to the child, and the child have sickle cell disease. So every time two partners have sickle cell trait, they want to have a child, 25% chance the child will have sickle cell disease. 25% chance the child will have neither sickle cell disease or sickle cell trait. You have a 50% chance that child will have sickle cell trait, just like the parent. So that's why it's important. So if you don't remember anything at all, just remember, if you have sickle cell trait, it's important. If you don't know, you know your genotype because it can impact your family decision making. Second thing is just remember that those rare complications I talked to you about, they do happen. Not happening to everybody, but they do happen. And so just like a seatbelt, you still wear your seatbelt when you're driving. So just know your genotype. Like I said, we have this partnership with 23andMe now that if you're in the US and you want to know your genotype, you can get a free test to know your genotype. And the last thing, if you're curious about why should I know my genotype, I strongly believe this. I think this is probably the most important thing. Knowing your genotype is actually you advocating for sickle cell disease, right? So people of us in the sickle cell space, we always say advocacy, advocacy. When you know your genotype, it helps you stay informed. You can also educate other people and really help make sure that a conversation around sickle cell disease is something that everybody at least knows, understands, and is equipped about. So thank you everybody for this conversation today. We can put that link back up so everybody can see it. If you live in the US and you don't know your genotype, you can get a free test to know your genotype. So this is really what I wanted everybody to focus on today. Like I said, follow Sickle Cell 101 on all social media at Sickle Cell 101. My foundation, we're doing a lot of work for the sickle cell community as well. Shameless plug. Please follow NOB_foundation. This is my foundation focused on helping people with sickle cell disease, and primarily in remote places in Ghana and Nigeria. So we actually have a Sickle Cell Awareness Month event going on right now. We're doing a free medication giveaway. We're giving some free clothing and some food supplies too. So visit NOB_foundation. If you want to donate or you want to just support our work, please feel free to do that. And please, if you do not know your genotype and you want to know, we've worked really, really hard to get 23andMe to offer us this free testing, a limited number of people. So please take advantage of it. And it's important that you know your genotype because it can impact your health. It can impact your family decision. And if you know your genotype, you're also advocating for sickle cell disease. So thank you. And I'll stop talking and see if we have any questions coming in from our audience today.
Awesome, Dr. Bote. We really appreciate your time this afternoon, this afternoon. We're different time zones, but we're in the same.
Close enough.
Close enough, right? So I know I appreciate the story, like the storytelling from the past 2 weeks up until now. And before our technical team go back to let us know the kind of questions that came in, I want to like ask a question in terms of like your clinical practice. Have you encountered anybody that look like us, right? And they still have that perception in the back of their head as to like sickle cell disease being a taboo. And also, if you've encountered such a thing, what are some techniques that you've used to help them calm down and use that to be able to educate them like, hey, this is actually a disease but not a taboo?
Yeah, I think excellent question. I've come across that actually quite a lot. I think it's just mainly because a lot of people do not just understand, right, the concept of the disease. Just like, you know, especially in Africa, when I say something like tuberculosis, when I say malaria, when I say, syphilis, you name it, polio, we automatically know those are diseases. Those are not, some kind of myth about it, witchcraft or anything like that, because we are informed about it. Now with sickle cell, we're not too informed about it because a lot of unknowns, and I think that's why there's those misconceptions. Now, what I usually do for a lot of people like that is, first of all, open the conversation for them to share with me what they know. I think that's how you break the barrier, right? Help people share with you what they know because we all don't know it. Oh, like I do a lot of research in this space. I'm still learning still. There's a lot of
Mhm.
evolving stuff happening. So first thing I always do is just encourage people, have the dialogue. Talk about what you know. What do you know? What from what you know is going to help us understand what you don't know. Now,
Mhm.
once we break that barrier, we dive more into reminding people, like I said earlier, it's a blood disorder. And these people struggle and deal with it a lot. It's no joke. I would be lying to you. It's severe. I don't live with sickle cell disease, but I've seen people living with sickle cell disease struggle too. So I think that's how I try to break the barrier and
Mhm.
just get them to a space where they can start having those conversations, right? I think what are the places where we find most people converge at? Church, schools, in our communities, and start having those conversations. Just like we're doing here, I think the more conversation, the better it is. But it's probably one of the biggest questions that I get a lot. People have that misconception about it being like a curse or witchcraft or something like that.
Got you. I see that there is a question of it's from Gifty Abyss, and she's saying that can the person with AA evolve to AS?
Yeah, that's a great question, Gifty. Thank you for your question. It will never happen, right? It will never happen. So, when I always give that explanation about how sickle cell trait evolved to serve as protective factor against malaria with that whole mutation switch. Those mutations that we talked about, they happen when you're conceived and when you inherit those genes. Once you inherit those mutations, that's it. They will never change, right? Unless, again, I'm going to give a caveat, unless, let's say, someone has sickle cell disease. Now, we have a lot of research right now into bone marrow transplant and gene therapy. One of the ways gene therapy is being studied now is they go in, take that mutation, and they fix it, right? So if someone has sickle cell disease and they're going through, say, gene therapy, and one of those gene therapies, these are not approved yet, this is still ongoing research, they go in and make that correction, for lack of a better term. Now that person, after they've got that correction, most of the time they might switch to AS or whatever the mutation would be. So that will be when there will be a switch. But to give this question, if I have AA all my life, AA all my life. If I have AS all my life, AS all my life. If I have SS all my life, SS all my life, unless I go through a gene therapy where they're going to help fix and correct that issue too. So it's very, very important. It's a great question. I get that a lot. Even people say, hey, I have SS. I think I just might switch and now I have AS. It's never going to happen. Maybe your complications are better. Maybe you take care of yourself better. Maybe you have more treatments, more options, but you never switch over after you inherit a gene from beginning.
Got it. Thank you. So my other question has to do with an individual that has, hold on, sickle cell and anemia. So in an event that someone has sickle cell anemia, I know last time we spoke about the whole blood transfusion thing.
Mhm.
And we also explained how a regular human being or a regular red blood cell lasts about 120 days, right?
Mhm.
With our brothers, unfortunately, dealing with sickle cell disease, are they able to donate blood, or are they just going to be the only ones that will be recipients of blood donation?
Yeah. So all things being equal, under normal circumstances, they should be able to donate blood as well. Like I said the other time, when you donate blood, it can be used for so many different things, right? So someone who has this sickle cell disease, they can donate blood, and the plasma in their blood could be used for a treatment or something else like that. But I will say, highly discourage that, because for someone with sickle cell disease, your body is fighting. Your body is fighting to make those red blood cells, like you shared. So unless you have sickle cell disease and you're doing just perfectly fine, you check your labs very often. You know where your hemoglobin is, where you can tell how well their red blood cells are doing. It's very fine. I highly discourage of people with sickle cell disease to go donate blood, because honestly, like I shared, their body and their blood cells are working overtime shifts just to at least get them to their baseline. And I'll give you a quick insight. So typically, right, people that don't have sickle cell disease, there's this thing called hemoglobin. I know it sounds like a mouthful for some. It's important we know that hemoglobin is like a protein. So those red blood cells that we talked about, it kind of sits in there. It's a protein in there, and that's what helps transport oxygen. So when you go do a lab at a hospital, and for people with sickle cell, if you don't have sickle cell, they will check your hemoglobin to see how well your red blood cells are doing. Typically, like say for me or for you or anybody that doesn't have sickle cell disease, numbers about 10 to 11 or 12. And it will vary a little bit if it's a woman or a female, but that's the estimate, right? 10, 11, 12. That's the number. Now, someone with sickle cell disease, sometimes their normal is a 6. If you and I had a 6, we'll be dead. So this is where the education is key, even for healthcare providers too, right? I've had healthcare providers where someone has sickle cell disease, they check their hemoglobin, it's a 6, and they're freaking out. And I'm like, that's their normal. Your body knows that. That's why their body is always working overtime. So when they get a blood transfusion, sometimes the best it will get it to is a 7, and that's all it can do. So I still to give context to the fact that donating blood, anybody can donate blood. It doesn't matter if you have sickle cell or not. But if you have sickle cell disease, I'll discourage that, because your body's working a lot harder, and I don't think you should put that on yourself.
Got it. Thank you. And I know that with this particular disease state, which is sickle cell disease that we're talking about, it often come with a lot of pain. And whenever pain come about, we always try to find a solution. We normally rely on ointments and stuff like that, right? So, in the event where someone has sickle cell disease and they have this pain, um, what treatment should they use? Is it the ointment, or is it just the pharmacological therapy that they have, such as like your hydroxyurea, hydroxyurea, is what they need to use, or what do you say when it comes to that point?
Yeah, I think that pain, it's kind of the cardinal, it's like the poster child symptom of sickle cell. It comes with sickle cell a lot. I always say pain treatment in sickle cell is multifaceted approach, right? It's so many different ways you can kill two birds with one stone, for lack of a better term. So I always say, for some people, the pain is they feel it in your bone, some feel it in your muscle, some feel it like in other places of your body. So if you have, like, say, an ointment that you feel like helps relaxes your muscles, I say you do that. But also keep in mind there's so many different aspects of pain too, right? So most people with sickle cell, they have their own staple acute medicines for pain, which will kind of knock the pain off the go. And they have their chronic management pain medicines like Tylenol, ibuprofen. And this is, I'm glad you had that question too, because we with sickle cell, unfortunately, a lot of doctors and even pharmacists don't do a good job educating them about some of these medicines that they take long term have significant impact too. So they could end up taking multiple medicines just to help manage chronic and acute pain, like Tylenol. It can in fact impact your liver long term. Ibuprofen, heart on kidneys, right? So I always say when you're taking these medicines, you can mix and match it, hydration, drinking a lot of water is important. And if I don't say anything about pain, I think every single person with sickle cell is different. Everybody's pain is different. I know some, you walk in the hospital room with them, say, hey, what's your level of pain? They say a 9, and they're doing just fine. And when I say doing just fine, that's where the stigmas are. They really deal with a 9, but they're used to it. So you might walk in there and you might assume, oh, this person is lying. They're not lying. They're really in pain. So
Hmm.
sometimes they have to take morphine, oxycodone, you name it, to knock out the pain. And then the chronic medications, the ones, especially the ones they take when they're at home, I always say alternate it, talk to your pharmacist a lot, understand the side effects of those medicines, take a break. And sometimes to food, right? There's some foods that are known to be anti-inflammatory. So I know somebody that personally everything that they eat, they put like ginger in there because it can help anti-inflammatory. So if you know foods that you know your body best that helps with pain, I always encourage you. So think about food, think about chronic pain, think about acute pain. Whatever you use to treat it based on your body, you stick with that and just keep talking to your healthcare providers and figure out when to switch it, when to use a new one. It's just tough. It's just tough to figure out what's the one size that fits all because each person is different.
Got you. I see that there are two more questions. I'm gonna ask for a technician to pull one up, and then I'll ask you another question. So it's from Gifty again. Gifty on a roll. Shout out to you. Um, so she's asking, do we have any lifestyle behavior or foods that a person with sickle cell disease should be aware?
Yeah, let's start with lifestyle. So lifestyle, I'm big on mental health. I'm unapologetic about it. I think that you have to surround yourself with the right people, right? Because again, sickle cell disease is a disease, it's a disease of stress, right? When you put stress in your body in any circumstance, that's when symptoms get worse. So I always encourage, as far as lifestyle, surround yourself with the right people, prioritize your mental health. Sleep is important. If you don't sleep, let your body, like I said, people with sickle cell, their bodies are working overtime. So give your body that sleep it needs, however many hours you need, 7, 8, 6, whatever it is that you know your body needs to feel fully refreshed, do that. Those lifestyle modifications literally could be the reason why somebody spends only 2 days a year in the emergency room versus 10. So those sleep is important. Hydration, it sounds cliche. Hydration is, it's more than even necessary because, like I said, sickle cell is a disease, blocking blood vessels, flush stuff out, flush it out. A lot of drinking, protect those kidneys are important. And then when it comes to like specifically like food, like I shared earlier, I think everybody's gonna say, "Oh, eat healthy," right? That's like everybody says that, but I always say to let's be realistic, right? We're all human. I always say enjoy the food you like, and
Yep.
sometimes when somebody is going through a stressful situation, maybe in that time, their best comfort food might be ice cream. I'm not saying eat ice cream every single day, but you have to at least, if you're eating a well balanced diet or overall, sometimes it's okay. It's okay to reward yourself and not feel too uptight. Like, hey, I always got to make sure I'm eating all these green foods. It's like, would you rather cheat your body by putting all this stress and not enjoying other aspects of life, right? It's a full total body health approach. So food, focus on the healthy foods when you can, a lot of greens, vegetables. Think about foods that will give you high folic acid, right? So I think a lot of legumes, a lot of salads, even high starchy foods. I'm not saying eat starchy foods a lot. There's some ongoing study. There's one researcher that sent me stuff about a compound in cassava that's actually known to be have some anti-inflammatory properties. So keep learning that stuff. I think that if you can eat those foods that you can tell, like even if you don't have sickle, so there's certain foods that you eat, you don't feel good after that. And there's certain foods you eat, you feel good. Like you prioritize, balance that stuff. But I always say if you don't remember anything at all, you just want to kind of eat a little bit better with sickle cell, think folic acid. You need that to make red blood cells. A lot of green leafy foods will give you that stuff. Legumes will give you folic acid. And I think if you do that, you're gonna be just fine. You prioritize your mental health. And every now and then, get that ice cream. Every now and then, get that one chocolate. Just enjoy life and just enjoy the full embrace components of life too.
Yeah, I agree with you on that with the whole ice cream. The fun question on the side before I ask you my final question. What's your favorite ice cream?
Cookies and cream.
You're just a regular guy, man. Like just cookies.
Cookies and cream, man.
I,
I
I like
probably no lie.
I
Yep.
like pecan ice cream. Is like I think is nice. But on a more serious note, though, I know in the presentation you had mentioned that you wouldn't be the one to tell married couples not to have children.
Mhm.
Now, before we even get married, right? What are some things that people considering or thinking about getting married to like consider in the whole process about sickle cell disease?
Yeah, that's a great. That's the question. I think the $1 million question with marriage counseling, and I get a lot of that. Some people fall in love with each other. They're so excited. They go to marriage counseling, and towards the end, the pastor will say, "Hey, have you guys done all your tests?" They go do a test, and then boom, sickle cell trait, and then they're crushed because some of them say, "Well, we can't go any further." Some say they can go any further too. So when it comes to thinking about getting married, the first thing I always tell people is understand and appreciate your family history. Like, I get it. Testing is not available everywhere, but sometimes just asking questions, ask your family questions. I know sometimes it's not encouraging our culture, but ask those general questions. You're gonna learn. You're gonna learn. Like, you find, oh, some uncle is gonna tell, wow, we had one person in the family one time ago that had sickle cell. You learn about your family history, you can at least know that, right? And then I always say, before you even think about going through counseling, don't let the pastor be the person educated about your health. If you get to that point, man, then you have issues. I'm sorry to say that. Be proactive about it. Go get tested if you can. I know sometimes those tests can be challenging, and then be open about it. I have a lot of stories where some people go get tested, they have sickle cell trait. They're so much in love with the person, they don't want to deal with going to find a new partner. They don't tell them. They pretend nothing, and they end up moving on. Boom, they have a child with sickle cell disease. So I think when you're considering getting married, aside just knowing you're getting tested, like I said, understand, appreciate your family history, ask questions, be honest with yourself and be honest with your partner. Sit down. If you both have sickle cell trait, say, hey, what does this look like for us? Do we have the finances, the resource? Where do we live? This child, we have a child with sickle cell disease. Is there a hospital that we know we can trust? We have healthcare providers to take care of. I've had people come to that terms and still had a kid, and they're able to take care of the kid. You honest your partner, or you both say, hey, this is not something we want to do. And that's also okay too. So I think the marriage part, especially for our youth, is probably the most important one. If you don't know your genotype, go know it. I think just learn about your family history. And most important, be honest with yourself and be honest with your partner, and figure out what you want, because it's going to change your life. People with sickle cell disease, talk to your parents, their caregivers. There's nothing bad on the people with sickle cell. They didn't ask for it. It changes people's lives. That's why we talk about this stuff too. So marriage is important. But I ask all those questions and get tested before you get blindsided, like I always say.
Appreciate the answer on that. I see that there's another question. So we're going to take that. And then after that, obviously, you're going to give your key takeaway as always with our conversation. And I'd like for you, for the key takeaway part, obviously switch dialect, speak the dialect that people understand on the other side of the world, and
Mhm.
that'll be appreciated. So this question is coming from Tom Dimas. He said in the management of pains and sickle cell, is it advisable to give, is it Penadin? That's what he
Mhm.
said.
Yeah, yeah. So great question. You said his name was Tom, right?
Yeah.
So Petadin, it's a Demerol. I'm sure you probably heard of Demerol. It's one of other drug that's like very common, used to manage sickle cell, so in pain crisis. It is advisable for some people. I know some patients that it doesn't work for them over time, right? So that's why I was saying earlier, when it comes to sickle cell pain management, it's so, how using the word complicated. It's so unique in the sense that some people, the medicine that works magic for patient A doesn't work at all for them. So if you've had good response to Petadin, I think you have that in your back pocket, right? When you're in those stressful acute pain situations, you can at least have conversation with your doctors, and that could be the go-to medicine. If you've taken that and it doesn't work for you, definitely shouldn't. There's some medicines for pain management. I have some patients that anytime they take their pain medicine, they get severe rash and itching, and they cannot tolerate it. And so you have to understand that, right? And so Petadin is one that I know some people benefit from. It's very powerful. It does work. But again, a lot of these pain medicines, we're being honest, they don't take away your pain. They
Right.
block your pain, right? That's what this whole thing is about. So while trying to block the pain, always try to seek answers to is what caused the pain. Was it because of the cold weather that triggered your pain? Are you staying warm while managing your pain symptoms over there? Was it hot weather, extreme heat that caused the pain? Are you staying well temperature too, right? So you have to really, I feel, I tell a lot of sickle cell patients all the time is your experience is your expertise, right? And as much as your doctor knows your experience, you're also an expert too. Some of these people, like, they get good at knowing themselves very well, know what medicines work and what doesn't work for them. So you speak up, you know what works, what doesn't work for you. And I'm glad you talk about Petadin because I know it's a drug that some people high on and some people are not. So if it works for you, I think, Tom, it's definitely something that I would have, or make sure my providers are giving me that medicine if that's one that works for me. And if it doesn't, there's so many different types. And my hope is in the future, Dr. Jared, you guys in the pharmaceutical space get to a point where we do studies strictly for medicines that's for pain for sickle cell. There's nothing ever being done. So I hope we get there. But that's a good question that he brought up.
Great. So, as I said before, we're going to wrap us up with the key takeaway of today's discussion about malaria to sickle cell trait, then sickle cell disease, and the connection. And every kitchen, right?
You kind of cheap.
My movie is
Yeah. You kind of cheap. And kind of cheap. Yeah. And then say, oh, there's a one to be beer free. Yeah. You accommodate more. First, I'm person will be at here and say, sickle cell, you cut sickle cell. The first thing you know, sickle cell disease, right? Obi or sickle cell disease, and you'll be at or what's that sickle gene, right? I didn't amount disease or me, in the zone back through mommy no papa and I was sickle cell disease. Now, so Obi was sickle cell trait at the trying to say or was that gene back up into sickle cell trait, baby if you buy and say a boa ma so nya malaria, it's me fighting malaria and a boa ma malaria chewa or body to make us say hey and a Mexico so no malaria no into malaria and tea and your sickle cell. Now when you almost sickle cell trait na what every time beyond someone will be 25% chance so crown being sickle cell disease. 25% chance I crown onye mubia. 50% chance I crown is being sickle cell trait to say mama and papa na. And no here in so beside say the internet also be a who genotype because when who genotype a bit me affected a crowd by one that here. Number two, to see in the new my who say or sickle cell trait, even though say omuni complications, granted sickle cell disease, I thought that rare situations, right? Intensity, I thought omunya complications, and a person who genotype sana, so it be a Yamifa Samba, so yes, I need pan back on bia when your complication at least ube no I hujuma. Into who here saw who genotype, and that the chat crown, the inti who here saw who genotype, and they said, so who genotype out. Also, so boy. Ama nkomodie any education any awareness any dwumadie ye physical so ho nyina also ye wo afemudie you're also helping to advocate for sickle cell so who genotype to misrel so wonni mu genotype a chronic who genotype so with US ha na wonni mu genotype na person who a called sc101.org/know your genotype. Yene 23andMe are partnership your my free test. Limited number of people into Mr. US which may be a free test. And the number will be at here. Your castle so yare and the bonnet a moja yare. Now so we need be now trade now which me the maumba. Until we are so home. It be one of our rare complications. Be anya crown genotype a wow because so wow will be our sickle cell disease. So no one I'm doing my chief for now. Cause so I'm questions and who here. So I need you identity. Me bompa say obia at least every sua be back afa in comedy ayedi ho na mado bia se biem se otie energy.
Dr. Boateng Yedawase, and your viewers know Yedamwase, say for the past few weeks, every Sunday, Moni and I walk you through the journey up to this point. Remember, next week, Sunday, a series in the baby in regards to Sickle Cell Awareness Month. Ms. Cheryl said, so I won't share BBI from the past 2 weeks that go back, replay, watch, and all questions be as well. Video be a watch no which major questions was here and answer which major questions of the most recent video I say. Then remember next week about we're gonna try to strictly make a Q&A session and to know Sebe all questions against me and somewhere now. Next week, God willing, when we meet on the platform, we would help answer all your questions that you have. Thank you so much for spending an hour with us. Wishing you a productive week, and we'll connect again soon. Take care. Bye bye.
Everyone needs compassion, a love that's never failing.